So now these about the movements of the scapulothoracic joint. So here possible movements are first one elevation movement, elevation and depression. Elevation and depression, these are one movement, and second one, second portion of the movement here will be having the protraction. Okay, protraction and retraction, protraction and retraction. These movements also called as the abduction. Protraction also called as the abduction, retraction also called as the adduction movements. And third way of movement here will be having upward and downward rotation, upward and downward rotation, upward and downward rotation movements we are having here. So these movements are also called as the upward rotation. See, upward rotation movement also known as the lateral rotation. Okay, lateral rotation. Downward rotation also called as the medial rotation. So these are the movements we can see in the scapulothoracic joint. But here the special point is whatever the movements are happening in the scapulothoracic joint, these are not isolated movements. What it means, the movement which is happening in the scapulothoracic joint, it won't be happening in the only scapulothoracic joint. One more two joints will involve. Those are acromioclavicular joint and sternoclavicular joint. Why? Because here clavicle is, why? Because here scapula is attached to the clavicle. The clavicle here we are having AC joint and here SC joint, acromioclavicular and sternoclavicular joint. So that's why the movements what are happening over the scapulothoracic joint, it is going to create the movement in the acromioclavicular joint and sternoclavicular joint. Now we'll see the elevation and depression. So if we see elevation and depression, these two movements are the translatory movements which is going to happen in the scapula. So now this is the resting position of the scapula. If the scapula is moving upward, this is elevation. If it is moving downward, that is depression. So these are the movements of the scapula, elevation and depression. These movements are the translatory movements. Scapula will move upward and downward. Now we will see the protraction and retraction. Protraction also called as the abduction and retraction also called as the adduction movement of the scapula. Okay, adduction movement of the scapula. So if we see here, these protraction, retraction or abduction, adduction movements are also translatory movements. Okay, translatory movements. So that here the scapula, when the patient is doing protraction that means abduction, scapula will move away from the body. If the patient is doing retraction, scapula will move towards the body. See here, if the scapula is moving away from the body, this is protraction also called as the abduction. If the scapula is moving towards the body, that is adduction, nothing but retraction. Now we'll see rotation. So now we'll see the rotation movements of the scapula. Here we'll be having upward rotation and downward rotation. Upward rotation also called as the lateral rotation, downward rotation also called as the medial rotation. So if we observe these rotations are completely rotatory movements. So that here, if we see, this is upward rotation, this is downward rotation. When we are doing upward rotation, scapula will move upward. So that here inferior angle. The inferior, when we are doing upward rotation, the inferior angle will come away from it will be like out of the body, away from the body. It will be like away from the body. If we are doing downward rotation, the scapula will move in this direction like downward rotation, so that the inferior angle of the scapula will move towards the body. So these are the movements of the scapula. So first one, if we see elevation, depression. These are the translatory movements. If we see protraction, and retraction. These are also translatory movements. If we see this upward rotation and downward rotation, these movements are the rotatory movements. Apart from these six movements, two more movements are there. Those are the anterior tipping of the scapula, and posterior tipping of the scapula. These two movements. Here we need one more joint, acromioclavicular joint, to understand this movement. So these are now we'll discuss in acromioclavicular joint. So these are about the movements of the scapulothoracic joints.